Since 2020, there's been a resurgence of yellow fever in Africa. Why is that? And what's being done to tackle the surge? My name is Marie Bracmont, from the World Health Organization's communications team. In this episode, we'll hear from Dr. Antoinette Mbailamen Demian, Director of Immunization at the Ministry of Health in Chad. How has her country faced the challenge of recent outbreaks?
Le grand défi, c'était l'afflux des réfugiés déplacés du Sud.
The big challenge was the influx of refugees from Sudan to the east of the country because we were not prepared for that. When a child comes at 5 or 4 years old without parents, you don't even know his status. You can't even know which vaccine he's had.
Il y a 4 ans, sans parents, tu connais même pas son statut. Tu peux même pas savoir quel vaccin il a pris ou quoi que ce soit.
But first, I'll be getting a yellow fever overview for the whole region from Dr. Charles Shey Wiysonge. He is the team leader for Vaccine-Preventable Diseases at WHO's Regional Office for Africa. We are Eliminate Yellow Fever Epidemics, I for short, with the inside story on yellow fever's expanding global risk. This is I on Yellow Fever. Episode 19, Yellow Fever's Resurgence. Could you tell us, Dr. Shey, what you've observed in the yellow fever situation in Africa in the recent years, and give us a broad overview of the situation?
The situation regarding yellow fever in Africa in recent years has been a concern due to a combination of various factors, environmental factors, epidemiological factors, and socio-economical factors that make it difficult to sustainably control a yellow fever in the region. This is manifested in form of yellow fever outbreaks, especially in countries that have implemented preventive mass vaccination campaigns 13 to 15 years ago.
Despite the fact that more than 264 million people have been vaccinated in at-risk countries since 2017, and thanks to the I initiative led by WHO, UNICEF, Gavi, and other partners, Dr. Shey acknowledges the factors contributing to the resurgence of yellow fever that he has seen in countries with mass preventive vaccination programs.
Despite extensive vaccination campaigns, gaps exist in coverage. Some areas have not achieved 80% coverage, which is the threshold for herd immunity. So this is due to many factors, including logistical challenges, limited healthcare infrastructure, and in some cases, vaccine hesitancy among the population. Also because a significant proportion of adults have been missed during the preventive mass vaccination campaigns. These mainly mobile populations in underserved areas. Also, in these areas, with increased population movements within and between countries, the virus can spread to communities of people that are not immunized.
What's more, urbanization has increased the number of people living in close proximity to each other, which can unfortunately facilitate the spread of yellow fever. And of course, mosquitoes multiply easily in urban areas where hygiene is inadequate. And that's not all.
Also, we have the issues of climate change and environmental modifications such as deforestation and increased urbanization without adequate sanitation. This enhances the breeding conditions for mosquitoes.
And as drinking water becomes less available due to climate change, people in urban areas without a water supply are keeping it at home longer, which increases the risk of it becoming a breeding ground. Out of the 27 high-risk countries, what's the proportion of countries affected by outbreaks or resurgence of yellow fever recently?
Over the past 3 years, 15 countries have reported outbreaks. More worrying is the fact that some of these outbreaks are in peri-urban settings, with the risk of spread to the large urban areas.
According to I recommendations, each at-risk country must reach over 80% of the population vaccinated to ensure collective immunity. How close has Africa come to reaching this target?
Approximately 264 million people have been protected against yellow fever for life through mass vaccination campaigns in Africa, with 4 countries, Angola, Ghana, Sudan, and Congo, achieving nationwide protection. Nigeria, the Democratic Republic of Congo, the DRC, and Uganda launched mass vaccination campaigns in 2023. Likewise, Chad launched mass vaccination campaigns in February this year, 2024, and Niger will do same in October 2024. However, there are concerns about the sustainability of these efforts, as gains made through campaigns need to be sustained by a strong routine immunization system. Only 5 out of the 27 high-risk African countries have achieved 80% coverage, so not much progress, but we are getting there. Ethiopia and South Sudan have not even yet introduced yellow fever vaccines into their routine immunization schedule, but there are efforts to get these 2 countries to introduce the vaccine.
Dr. Shey, you've mentioned the importance of trying to reach as many children as possible with yellow fever vaccines. What is the problem of low immunization coverage and not having 80% of the children vaccinating against the disease?
When we don't have up to the 80% coverage, at least, then children will not be protected. And this can be, if they don't get the vaccine at any time, then they are unprotected for life. And then there is this risk of having the disease. And if there are many of them, then the risk of outbreaks. Children who miss their yellow fever vaccine will be unprotected during their lifetime. So we do really need to use every effort that we have to ensure that we reach children who have missed their vaccination, and we have at least 80% coverage in every community.
Following the resurgence of yellow fever in certain high-risk countries, an analysis of root causes and gaps in vaccination equipment has been carried out, and particularly for Guinea and Cameroon. Dr. Shey sums up the results.
Most of the cases in Guinea, for example, in the outbreak in Guinea, occurred in children. A root cause analysis identified a weak routine immunization system as a cause of the outbreak. In both countries, Cameroon and Guinea, there is increased exposure due to the population activities in forest areas where yellow fever circulates. And the main underlying cause relates to pockets of unprotected people and also the weak immunization system. In Cameroon, it has been more or less the same situation. There's an increase in Cameroon. There are a lot of activities in forest areas where yellow fever circulates. And the main cause in this area is that there are pockets of unprotected populations, and also the routine immunization system in Cameroon is not great. The coverage is not up to 80%.
Dr. Shey is also Professor Extraordinaire of Global Health at Stellenbosch University in South Africa. His research has identified the obstacles to achieving mass vaccination in the region.
So this research of looking at understanding why vaccination coverage is low and then finding strategies to address that, it falls within the general area of what we call implementation research. And implementation research generally, it helps to address what we call the no-do gaps in healthcare settings. That is, the gap between what we know and what we do. Because very often we know already a lot of things. We've understood what the challenges are, what the reasons are in various communities why the coverage is low. Very often we have effective strategies which have either been implemented in the same settings or in other settings. And it's just a matter of adapting those strategies and use to improve. But a lot of times we don't always implement the effective interventions that we know that work. And some of this might just be because constraints in human resources. It might be because we know these interventions work, but we don't have the funding to be able to implement this.
Dr. Shey's research also highlights the issue of vaccine hesitancy. This is a complex problem.
Vaccine hesitancy, usually when we talk about vaccine hesitancy, we are referring to the state where people are conflicted about or opposed to getting vaccinated. And We know that this is a complex social process that is shaped by multiple factors. In some settings, trust play a very big factor. So when people don't trust the efficacy and the safety of vaccines, then they don't go for vaccination services. So that plays a factor. Also, in some settings in Africa too, they also probably do not think that they are at risk of those diseases. So it's a mixture of many factors. Trust in the healthcare sector, trust in the authorities that take decisions about vaccination, trust in the healthcare workers that deliver vaccines. So when there's lack of trust, then there is a decrease in demand for vaccination and in acceptance of vaccination, and then there's an increase in vaccine hesitancy.
There is also the impact of misinformation and rumors surrounding mass vaccination campaigns, especially during the COVID-19 pandemic.
We've had the disruptions related to COVID-19 pandemic. And this led to already very low coverage that we had at the time. The average coverage across Africa in the region was about 75%. The vaccine that we usually use for that is the diphtheria, tetanus, and pertussis vaccine for 1-year-old children. Now, with the COVID-19 disruptions, it has gone down now to about 72%. So in addition to the access and availability and community issues around community acceptance, we have had disruptions with the COVID-19 pandemic. And what has happened during the COVID-19 pandemic is that there was a lot of talk about vaccination, a lot of misinformation, a lot of rumors, which led some people not only to doubt COVID-19 vaccines, but also the efficacy and the safety of the vaccines that we already had in the system. So a combination of all those factors have led us to where we are now.
And there is more with the situation of nomadic or refugee populations linked to a conflict.
Parts of Africa where some of these high-risk countries for yellow fever, where there are conflicts across the belts there from West Africa and Guinea right up to Sudan and South Sudan. Many of these countries have areas of insecurity, areas of conflict. And what happens then is health services are disrupted and people do not access the health services. And then also, during that time, there's population movements and people moving to areas where there might not be health services available. So a combination of factors with the population movement, insecurity, and conflict lead to pockets of unvaccinated people.
My thanks to Dr. Charles Shey Wiysonge, WHO Africa Team Leader for Vaccine-Preventable Diseases. You are listening to Eye on Yellow Fever. This is episode 19, meaning there is now a wealth of previous episodes for you to go and find in your podcast player. If you're discovering us for the first time, please go ahead and give them a listen. We would also love you to spread word about the podcast. Please recommend us to friends or colleagues you think would be interested in learning more about yellow fever or have an interest in infectious diseases. Chad is one of the countries that until this year did not have a mass preventive program against yellow fever. I am delighted to welcome Dr. Antoinette Mbailamen Demian, the Director of Vaccination at the Ministry of Health in Chad. It's important to understand the facts about this huge territory.
Le Tchad, comme vous savez, c'est un pays qui est très très vaste.
Chad is a vast country with 1,284,000 square kilometers. And Chad has 3 climatic zones. First, the north with the Saharan zone, which means that 60% of national territory has a desert climate. The south is the Sudanese zone, that is 10% of the national territory. It is a rainy zone. And between the two lies a Saharan zone, which is the other 30% of the national territory. Economically, Chad has been oil producing since 2003. We depend heavily on this resource. And from 2014, the economy has been affected. We also have a lot of refugees who are currently in Chad, the Sudanese, the Central Africans, the Cameroonian too. And the index of fertility, the ISF, is very high. 6 or even 7, if I am not mistaken. We have a very young population.
Si je me trompe pas. Et aussi, la population est très jeune.
What are the challenges to be faced regarding the organization of healthcare in Chad, taking into account the diversity of the population across the country?
Le taux de mortalité, même des enfants.
The mortality rate of children and pregnant women is highest in the region. So the issue is universal access to quality health care so that we can reduce mortality, especially in the most vulnerable section of the population, that is mothers and children. But as the territory is huge, there's also the problem of accessing health care because as soon as there's a rainy season, the provinces are cut off and we no longer have access to these districts. This is one of the major difficulties here in Chad.
Accès à ces districts, donc c'est l'un des difficultés aussi ici au Tchad en fait.
These challenges have recently been compounded by the declaration of a state of emergency to tackle malnutrition, especially among children. This inevitably has had an impact on infectious diseases such as yellow fever. So what is the situation regarding yellow fever over time?
En 2013, l'épidémie a touché 5
In 2013, the epidemic affected 5 districts in the eastern provinces of Chad, and the entomological studies showed a particularly high density of yellow fever vectors. Then, in week 38 in 2021, another epidemic broke out in these 20 districts, mainly in the south, those of Gandhi, Moisala, and the Mandul. And the latest until 2022. There was an automatic response to the campaign, and that's what protected the population. In week 1, in 2023, there were a total of 1,109 suspected cases of yellow fever, in which 886 cases were investigated. 10 deaths have been recorded since the beginning of 2023, compared to 16 at the same time in 2022. And from week 1 in 2023 to week 52, 134 districts out of 115, that means 89% of the country, reported at least one suspected case of yellow fever, compared to the 127 out of 139 at the same time in 2022. So we can really measure the extent of the epidemic in the country.
On voit bien l'ampleur de l'épidémie au pays.
Dr. Demian, which parts of the populations are most vulnerable to yellow fever in Chad?
Toutes les tranches d'âge sont concernées d'abord et plus de la moitié.
All age groups are vulnerable, and more than half of cases, 60%, are male. And there are 4 age groups that are the most affected: 5 years old, 6 to 15 years, and 16 to 25 years. 26 to 45 years old, which are the highest mortality. I should say that half of these recorded deaths were children under 15 years of age. And this vulnerability among young people is explained by their social and professional activities. There are also as many deaths among male patients as there are among those of female sex. So many more young people figure in the death rates because they are most frequently in contact with mosquitoes. And we all know that it is mostly the rural population which is affected because they work in the fields and in the forest. So the impact is felt much more in rural population than urban ones.
L'impact, c'est beaucoup plus sur les populations rurales que urbaines, en fait.
Was the population afraid in 2022? Did they feel a sense of danger?
En 2022, au district, comme je l'ai dit, au Mandul, quand la population...
In 2022, in the district of Mandul, when the population learned about the death rates, there were concerns, and they sought to get vaccinated because of the high death rates. They saw that vaccination was the way to protect the population of Mandul.
La réponse a été de qualité. On a pu protéger la population du Mandul.
Given the different landscapes in Chad, there are major logistical challenges to overcome. For instance, you need an efficient cold chain, which is a temperature-controlled supply chain, enabling the storage, transport, and distribution of vaccines.
Le Tchad est immense. Donc, les défis logistiques, c'est l'insuffisance de moyens roulants, vu l'étendue du territoire.
Chad is immense. So the logistical challenge is the lack of means of transport given the extent of the territory and also the accessibility to each health center in each district. And then there is the problem of maintaining a cold chain in some districts, especially in the borders districts, because of lack of safety. Let's just take one example. A few years ago, a district doctor with his nurse and his driver had gone on patrol and the Boko Haram kidnapped them. It took months for them to be freed, and it was the military which was able to recover them. So safety is one of the problems, as well as lack of transport and maintaining the cold chain as well. We had a cold chain assuring 86% coverage. But as the population increased, we also need to create new health centers. So the demand increases and the cold chain coverage goes down. And when we don't have an adequate cold chain, we can't do a campaign, not even a routine vaccination campaign.
On peut pas faire une campagne ni même la vaccination de routine en fait.
It's hard to imagine the difficulties of working in such conditions.
Oui, et puis avec aujourd'hui par exemple, nous sommes à 43 degrés. Imaginez.
Yes. Today, for example, the temperature is 43 degrees. Imagine people who are in the north, in the far north, where it is 45 degrees. You have to go and get vaccinated during a campaign. That's why we prioritize campaign in certain periods. And there are periods when we can't carry out campaign because of the roads are inaccessible. Most of the country is cut in half by the rain. There are a lot of wadis, for example, for the east. And when it rains, you have to wait days and days for the wadis to recede before you can cross by car.
Il faut attendre des jours et des jours pour que les wadis passent avant de passer avec la voiture.
At the time of our discussion today, we are in March 24, and you are preparing for the African Vaccination Week soon, which will take place at the same time as the World Vaccination Week at the end of April. What action are you taking in Chad?
Oui, le Tchad a toujours célébré, comme on dit, la SAV, la semaine africaine de vaccination. C'est la même chose que la semaine mondiale.
Yes, Chad has always observed the African Vaccination Week. It is the same thing as the World Vaccination Week. And during the week, we implement intensified vaccination measures. For instance, last year, we launched everywhere in the country. And during the African Vaccination Week, we did the IPVs, the periodic intensification of systematic vaccination to make sure children are caught up. We put in place advanced mobile strategies, and it is also an opportunity to inform the population of exactly what we are doing and when we are doing it, and to negotiate with the authorities so that they get more involved in vaccination. And our goal during the week is to ensure communication so that the population, the community itself takes vaccination into its own hands. It is a situation where mothers have to participate and fathers have to participate so that children get vaccinated to avoid epidemics. Because if routine vaccination works, we will no longer have epidemics.
Vacciner pour éviter les épidémies. Parce que si la vaccination de routine marche, on n'aura plus d'épidémies.
How do you coordinate with partners, including the ministries, to increase awareness in Chad during this week of vaccination?
En fait, nous, on travaille, comme on le dit, au système de santé, on travaille avec tous les ministères.
In the health system, we always collaborate with all the ministries. When we have campaigns, we send notes to all the ministries, and these ministries send instruction at the provincial level. And it is the governors who launch our campaign in the provinces. And there, the provincial delegates also represent the health ministry. Most of our activities are done together. There are areas where there is a lack of safety. So when we send instruction, the military accompany us to go and vaccinate the children and to protect us. And the ministry also manage the traditional leaders. When we send them instruction, they give this to the traditional leaders who for their part are a valuable support to us because it is to them that the population listens most. So then, the religious leaders and the administrative delegates from these provinces all go into action together.
Avec les délégués de ces provinces, on fait la mobilisation ensemble.
For the first time, in February 2024, Chad launched a mass vaccination campaign against yellow fever. A great moment for Dr. Antoinette Demian and her team, and a difficult task.
On sait tous que les campagnes...
We all know that the yellow fever campaigns are very tough because they are aimed at more than 90% of the Chadian population. And in particular on the side of logistics because we do not have the means or the capacity to do the whole country. We divided the country into 2 blocks to really carry out a thorough campaign. This campaign concerned 12 provinces. When we got the result, we had achieved more than 19% coverage. We hope that the population will be protected and that we will no longer have cases of death from yellow fever. The particularity of this campaign is that we integrated it with the measles campaign. There's a permanent measles epidemic here. So the mothers of the children know what measles is. Some have also seen yellow fever.
Certains connaissent aussi la fièvre jaune.
It was a great success, but with many challenges to learn from.
On a eu beaucoup, c'est vrai, des défis, mais on a su...
We had a lot of challenges, but we overcame them. We did field trips a few months before this campaign to microplan with the health centers. So it was they who pointed us to the correct population to aim at. And the integration with measles was very beneficial because when there are measles epidemics, the mothers ask for the measles vaccines. Because of that, we were able to vaccinate a lot of children from 9 to 59 months. And adults also had the vaccines.
Et les adultes aussi ont pris.
But the greatest challenge was to roll out a successful communications campaign which would reach the entire population.
Il fallait vraiment communiquer. Et la fièvre jaune, c'était pas que les enfants de 0 à 59 mois.
We really have to communicate well. We had to target the communication strategies by age group. So for instance, for age groups from 10 to 25 years old, it is more about social networks. It is more television and radio. We accentuated that too with videos. And then there's the older age group up to 16-year-old. They are more interested in new challenges. So we went to the television station to also target that. It depends on the environment where the person comes from, whether it is rural or urban environment. For the rural environment, we involved the authorities like the local chiefs and the religious authorities like the imam and the pastors of the country all over the nation. They made videos and we broadcast these videos on social networks. And every time the supervisors go somewhere there is resistance to vaccination, we show them the videos. We say, this is the chief asking you to get vaccinated. And on the launch day, our minister had the vaccine to demonstrate. All our partners and the representative of WHO had the vaccine. Communication is very important to successful campaign. Without good communication, we can do nothing.
Et c'est sans cette communication, on peut rien faire.
Social media, television and telecoms have all played a key role in this communication campaign.
Et aussi, on a utilisé les réseaux téléphoniques qui nous ont
and we also use the telephone networks. They help us by broadcasting the message to all telephone users for free. These messages were very effective for us and for the authorities of the ministry. We all had the vaccine in front of camera to tell people the vaccine is safe, we are getting it protects us.
Devant la caméra, pour dire aux gens, voilà, le vaccin est sûr, on prend ça, ça nous protège.
It was especially remarkable how young people really made the success of the communication campaign.
On a compris que la communication, quand tu passes la communication chez les enfants,
we understood that when you aim the communication to the children, it is sometimes they who convince the parents. We went during the campaign and vaccinated from school to school. We mapped all the schools. We thought that there may be resistance, but it was the children who were the most actively enthusiastic because they were proud. Those who were under 5 years old had 2 vaccines, always including the yellow fever one. And some went home to say, "Mom, I got this vaccine. You have to get vaccinated." The parents were also happy. It is true that there were some reluctances, but especially in Jamena, we were able to support the team of supervisors to explain the benefits of vaccination, especially in school or classes where there are a lot of students to protect.
De la vaccination, surtout dans les écoles ou les classes, il y a beaucoup d'élèves pour les protéger.
And let's not forget the travelers arriving from other countries. Since the outbreak of the current conflict in Sudan, Chad has taken in the largest number of Sudanese refugees, now numbering well over 500,000. There are also refugees coming from Central African Republic, Nigeria, and Cameroon. How can we meet the challenge posed by this influx?
Le grand défi, c'était l'afflux des réfugiés déplacés du Soudan à l'est du pays parce qu'on ne s'était pas préparé à cela.
The big challenge was the influx of refugees from Sudan to the east of the country because we were not prepared for that. As soon as the refugees arrived, we prepared a response plan. For every 10 children who arrived, maybe 8 or 7 were 0 doses or poorly immunized. We did a preventive campaign in the 3 provinces, and it still continues because there are a lot of different sites affected. For instance, take the case of Adre where there are a lot of refugees. The city was not prepared for them, and it is not a city that can support more than 400,000 or 500,000 people. It is complicated, especially with supplies of water and education. When you see this condition, it is really hurtful, and psychologically, it is grueling for the mothers, and there are children who arrive who are less than 5 years old without parents. Because of trying to escape the war, vaccination was not their priority. We had 2 cases of mothers running away from fighting. They have the habit in Sudan to tie the children to their backs. And the mother was so focused on getting to a camp that she didn't even realize that the child who was tied to her back was dead. So that only when she arrived in the camp and untied the child, she realized that the child was dead. So we really see the extent of the horror of the situation in these camps. When a child comes at 5 or 4 years old without parents, you don't even know his status. You can't even know which vaccines he's had or whatever. And even when we checked with Sudan, even before the crisis, the data for measles was not very good. We know that there are a lot of 0 doses, but so as we go along, when we do the campaign, we recover these children, and there is the big catch-up that is coming too, and we will also do that.
Il y a le big catch-up qui arrive qu'on va aussi faire.
Yes, in order to catch up with the level of immunization, which was lower during the pandemic, in 2023, the partnership between WHO, Gavi, and others launched the big catch-up during the African Vaccination Week at the end of April. Apart from the difficulties added by the influx of refugees from Sudan, there is also the issue of climate change and its consequences for the different populations of Chad.
Si on prend le Grand Nord, les nomades, ils se déplacent là où il y a de l'eau pour pouvoir...
If we take the north, the nomads, they move where there is water. But with climate change, we can see that Lake Chad is shrinking with each year. And that has a big impact, even for fishermen. In the case of fishermen, it is their only livelihood. But when the lake is shrinking, financially speaking, they can no longer take care of themselves as they should. And then this impacts on the family. And the family can no longer take care of itself as it should. And when there are cases of disease, especially here, when you go to the health center, you need to pay. The impact is at all levels, in fact. It is terrible. Every year, things do not improve much. But when, let's hope that things will change.
Climate change is having serious consequences for rural populations, but it is also affecting urban populations, such as those in Chad's capital, N'Djamena, in terms of the transmission of yellow fever. There are problems of poor hygiene in disadvantaged areas, and there are other problems specific to more affluent neighborhoods.
La capitale, c'est, comme on dit, c'est là où il y a tous les soucis du monde parce que
the capital, as they say, is where there are all the problems in the world because of the population flux, the toing and froing. And as we know, in certain neighborhoods, the posh ones, when we want to do door-to-door campaign, we have trouble getting access to these houses. It is here that misinformation is common, where everyone says that the vaccine is not good, especially in relation to even during COVID-19. They say the vaccine makes you sterile, the vaccine does this, the vaccine does that. And these areas have easy access to social network. There are a lot of people who start talking nonsense about vaccination. So it is they who are sometimes a little reluctant. That's why in communication plans, we design specific strategies for the urban and rural context. And in the rural environment, there are a lot of people who are anti-vaccine.
Il y a beaucoup de gens qui sont anti-vaccins.
As our guests have testified, misinformation is one of the toughest elements to tackle in vaccination campaigns. In all these efforts to combat this disease, Dr. Demian and her team have been working with the I strategy team and its partners. How is this collaboration working?
Je pense que c'est très bien de faire des stratégies autour d'une pathologie.
I think it is very good to make strategies around a pathology. It allows us to all contribute effectively rather than each partner coming with their own agenda. So, we thank the strategies, especially because you send us some experts who are very competent. They were with us during the planning and during the campaign. So we hope that other pathologists will follow the example of the I strategy.
On espère que d'autres pathologies vont suivre l'exemple de la stratégie I.
What lessons could Dr. Demian share with the other neighboring countries that are also fighting yellow fever?
La leçon la plus importante, c'est que
the most important lesson is that as long as we don't involve the people, I don't think it can work. The biggest lesson is to involve the community in the strategies that we develop and also to build trust. Not everything that comes from above works best. It is community commitment that ensures success, as well as micro-planning at the start. When we did micro-planning, it was with the whole community. So it was one of the most beautiful experiences, I think. And so the crucial elements are really the involvement of the community and the involvement of other sectors, especially bloggers, artists, influencers, all that. It is all about ensuring a very good communication to allow very good results when we do the campaigns.
Pour permettre d'avoir des très bons résultats quand on fait les campagnes.
Dr. Charles Shey has given us a fascinating overview of the factors behind the recent resurgence of yellow fever, and we were privileged to hear Dr. Antoinette Demian explain in detail what is really involved in her work to combat the resurgence. I would like to thank my two guests, Dr. Charles Shey and Dr. Antoinette Demian, for giving us the benefit of their expertise in learning more about this disease, yellow fever. This episode of Eye on Yellow Fever was produced by Amanda Hargreaves with sound design by Adam Whaley. I'm Marie Bracmont. Eye on Yellow Fever is a Bengo Media production for Eliminate Yellow Fever Epidemics.